What are flat feet? The terms flat feet and overpronation are often connected and associated as something that's bad and needs to be corrected. And so you hear individuals say, I have flat feet, so I can't do this, or I have flat feet, so I need that. So where does this come from? We talked about pronation in the earlier video where excessive pronation is going to have the forefoot be inverted, rear foot everted, and the medial arch is going to lengthen and lower, and supination will be the opposite action, but this excessive pronation is going to lead to this lower arch. So what's this look like? At the foot is excessive pronation rotating towards the inside. This arch is going to lower and lengthen versus moderate arch or extreme version of a higher arch. And so in some cases, overpronation, flat feet, and poor movement are connected. And so one example would be you cannot control this loading phase of gait. You go into this excessive pronation, your arch lowers and lengthens, and it's correlated with some movement, for example, of the knee or Achilles, hips, lower back. But it's very important to understand that this is not always the case. The appearance of your foot, the position and alignment, and the function of your foot and your body as a whole are three separate elements. And so there's really three different categories that we can have with these three elements. So the first category is flat foot, overpronation, poor movement. As we mentioned, they'll struggle during the loading phase and transitioning to propulsion, and potentially they can have injury history or a risk of injury because of this movement. And so we'll talk about how we might want to implement some coaching or clinical changes. The second scenario is you can have a lower arch, but the foot is actually in pretty good alignment and you move really well. And some of these scenarios are really, really high performing athletes. So if you look at the athlete from the side and you say, oh my gosh, this is a low arch and flat feet, and then you can assess them from a rear point of view, and they're in good alignment. You look at their foot mount weight bearing, rear foot, forefoot, both in good alignment, and you do a movement assessment. Let's say you have them squat, single leg, everything's in great alignment. On the field, very high performers, low injury history, no pain associated. And so we really have two very distinct types of flat feet. The flat feet that's a result of this excessive pronation, or just somebody who happens to have a lower profile, lower arched foot, but is in great alignment. And so this third scenario is somewhere in between where they do have a lower arch, their foot is in relatively a pronated position, and so they might, stand with their feet rotating a little bit to the inside, maybe somewhere between 4 and 10 degrees standing inversion posture. But they don't have injury history or pain. What's really important here is to check the single leg movement and do a really thorough assessment. Because what you have to assess is a change needed? If somebody has this flat foot, really excessive pronation, poor movement, injury history, this is really easy to say, all right, let's bring in a clinician, do a full assessment, what type of intervention is needed, and during that assessment, really important to understand, is just this a temporary position they're finding themselves into? Is this soft tissue issue, or is this something with their bone structure? And then based off of all the assessment, what's the best performance plan, treatment plan going forward? But when you have this foot that's somewhere in the middle, you really have to consider, is a change needed? And so for the example where we had a lower arch foot, but they're in good alignment, they're moving really well, if we just think of all flat feet as being the same, and we give them arch support, say, all right, we want you to have a nice high arch, what that's going to do is actually take them out of alignment. So let's say this low arch foot is very neutral, they're moving really well. Let's say we need to give you a high arch, that's actually going to take them out of alignment and can cause issues. So very risky to kind of look at all flat feet as being the same. And what we really have to do is consider pain, injury history, position, function, movement, and what are their performance limits? How are they moving? And so if somebody tells you you have flat feet, sometimes they'll know what they're talking about. Sometimes they might have a misunderstanding. And so, again, we have to look at the function and the position as well. And let's say you do have a flatter lower arch foot that's the result of poor movement, and we need to clean up that movement. We need to address hips, the feet, and then consider if is some type of support needed and what level of support is rightfully